Hello. Hello, everyone. Our topic for today is the vital role of the health plans in the Israeli healthcare system. Our special guest today is Professor Shlomo Mor-Yosef, whose illustrious career has included being the Director General of the Soroka Medical Center, of the Hadassah Medical Center, of Israel's National Insurance Institute, and Israel's Population Immigration Authority. Today, Shlomo is the chairman of the board of the Leumit Health Services. He has also been a past chair of Israel's National Institute for Health Policy. Shlomo, I'm delighted to have you with us here today.
Hello, thank you for the invitation. It's a great pleasure and honor to participate in this project.
Terrific. So tell us a bit about your thoughts about the role of the health plans, the Kupot Cholim, the health plans in Israel's healthcare system.
The Israeli healthcare system is based on the HMOs. Some call them HMOs, some call them sick funds, we call them in Hebrew Kupot Cholim. But if you look from the perspective of the patient or the citizen, he knows that for getting any type of medical treatment, he has to approach the HMO. If you look from the government side, they delegated all the responsibility for medical services to the citizen, to the HMOs. So on one hand, in Israel, the system is very centralized and fully funded by the government. On the other hand, it's fully operated by the HMOs. And this is very, very unique for Israel. And I think it gives many advantages. We have in Israel 4 HMOs, and they cover all the citizens and residents in Israel. Everyone should be enrolled in one of the HMOs. So it's fully coverage. The 4 HMOs, all of them are national HMOs. So they have clinics all over Israel. They are not in the same size. One, the Clalit, is the biggest, is about 4.5 million insurees. We at Leumit are the smallest, of around 800,000 insurees. So in Israel, it's small, but generally, you all know, 800,000, it's a relatively fair size with a budget of 7-8 billion shekel a year, with 300 clinics all over Israel. So these 4 HMOs are responsible. The payment from the citizen are not going directly to the HMOs. The Israeli pays health tax. And if they pay health tax, they pay to the government or the National Insurance Institute. The government, via the National Insurance Institute, distribute the fund to the HMOs according to some capitation formula, which based on the number of insurees, of course, their age, their gender, and place of living, if the central or periphery.
Now, England also has a publicly financed system, and they don't have this complication of 4 different insurers. Everybody gets their care through the National Health Service. What do you see as the advantages of having 4 competing health plans?
I lived for 1 year in England, and I practiced in gynecological oncology, a big center. I'm a gynecological oncologist. I used to be. And I can tell you it's a huge difference. The main point is competition. In England, there is no competition. It's governmental. Every area has its own responsibility, and whatever they do, they can do it good, bad, better, whatever. In Israel, these 4 HMOs are competing on a daily basis between each other. So you say you pay to the government, you receive the fund for the government. So what is the competition about? The competition is about quality and service. I must say that, you as a patient, the ability to evaluate quality is relatively very difficult. But service, you know to appreciate. And I can tell you from my role today as the chairman of Leumit Health Services, which is an HMO, I live this competition on a daily basis. If you open the Israeli television, every night you see advertisement of all these sick funds. If you look outside on the streets, so if you ask about the difference, this is a governmental service and this is a governmental service.
Now, of course, competition, one aspect of it is advertisement, but as you and I both know, it runs much deeper than that. It's really about the quality of the service. Can you give some examples in recent years, maybe even from your own HMO? What are some of the service improvements or ways you've changed things to make things better for the patient and to get people to stay with you? We also know that people can switch health plans very easily in Israel. It's not like the US where it's employer-based. Here you can switch easily. What are some of the things that Leumit, for example, has done recently to keep people with it and to bring in new people?
You mentioned very easily the ability to move between HMOs. This is a central part of this competition. I mean, every Israeli can move from HMO to HMO with no problem. If he sick or if he healthy, doesn't matter. You want to move HMO, you can move HMO. So this, of course, contributes to the competition. So for your question, examples. All the digital services are because of competition. I mean, you start in one HMO a digital service, the other can't stay behind. And if you look at the Israeli, from my HMO today, 40% of the 40% of the interaction between family physician and the patients are digital.
And that consumers want that, or it's being forced upon them?
It's not forced. You can choose. You go to the application. Another issue, every HMO has an application on your cell phone. You enter the application and you made an appointment, and they ask you which type of appointment you prefer. You want to come to the clinic, you want by telephone, you want by video. And according to what you choose, your appointment is made. So it's fully selected by the patient. So this is one of the examples. The other example is the type of services and their location and accessibility. So today, the big issue in Israel is mental services. And let's say 3 years ago, mental services were centralized in few areas and you had to go to this area. Today, because of the need, there is a spread of services in, I can't say anywhere, but in many places. And this is also part of the competition. And telephone response and services. It's very, on a daily basis, insuree can come to your office and say, if I won't get this and this, I'll move to another HMO. It's a daily discussion. And this keep all the 4 HMOs on toes. The HMOs are responsible to give all the services in the health basket in Israel. The health basket in Israel is very wide. And it's in the community, in the hospitals, and prescription drugs. But there is supplementary insurance that operate by the sick fund or HMOs. This supplementary give to the citizen a broader services, and the competition goes there as well. What how many physiotherapeutic treatment you can get in this service and how many you can get in those service. And you can imagine that we are looking all the time what the other three HMOs are doing, and we try to see where are we better, when you have to catch up. So if you look at the service, if you look at the supplementary services, the competition is there on a daily basis. The advertisement was just a sign of it. It's not the issue itself.
Terrific, terrific. So for my last question, I want us to take advantage of the fact that you have had senior positions in government, in hospitals, and in health plans. Very few people have that. And I'd like you to share with me your thoughts on maybe one thing that each of those groups is particularly attuned to that the others might not be paying attention to. What's the special focus of government that the others might not be attention to? What do people see from hospitals? And what are some of the things that you see from the health plan leadership role that you don't see from the others?
You know, I grew in hospital. I grew in Hadassah Medical Center in Israel as a physician, as a senior physician, and as a director general for 11 years. And I thought that I know the Israeli health system very well. But I knew it from the perspective of one hospital, a central hospital, and we at the hospital thought that this is the center of the world. And this is what is important for the patients. And to tell you the truth, how you do a catheterization of the brain is very important. And you have a quality physician and equipment, but it interests very, very limited number of patients. Who is your pediatrician? Where is your pharmacy? Is more important to the Israelis. And this you see from the HMOs. The HMOs see the ordinary citizen, patient, whatever you call them, insurees, and you see the daily needs of them. The hospital, you see the unique needs of the hospital, and usually there is no connection between it. The only connection that I experienced was when I was Director General of Soroka Hospital. Soroka Hospital owned by HMO, so it has some more good relation with the community. But still, it looks to the system as in the hospital eyes. In the government, you're supposed to see the big picture, not just the community, not just the hospital. And the main point from the government side is planning ahead. We are not very good at it. Only here, the competition between hospitals, you see sometime that you are wasting time. You have the same services 10 kilometers from each other. But the main focus is to look at the bigger picture and to try to give the same services to people at the center and in the periphery. And we have a lot to do in this field.
That's terrific. Shlomo, thank you so much for joining us today and for all your tremendous work for Israel and Israeli healthcare, both in your current role as well as in your other many leadership roles. Thank you so much.
Thank you very much. It was a pleasure.